your nomination. First question that I'm asking of every nominee for this administration: if directed by the president to take action that would break the law, would you follow the law or follow the president's directive?
The president would never do that.
That's absurd. It's a disappointing answer. Now, the Medicaid program covers over 70 million Americans, and the Congressional Budget Office has now confirmed that the Republican budget plan would require taking away Medicaid coverage for millions of people. In New Hampshire, the Republican budget could take away health insurance from as many as 30,000 children. Do you support the Republican budget plan that terminates the health coverage of millions of Americans, including as many as 30,000 children in my state?
Senator Hazard, I've not seen the details of a House bill that says that. I look forward to examining it with great care if confirmed by this.
So let me ask it another way. How many children losing health insurance would be acceptable to you?
I don't want children losing health insurance.
Well, then you're going to need to reject the Republican budget plan. You and I did talk about maternal health crises. Medicaid covers 40% of births in America, 50% of all rural births. So will you commit to preventing any cuts to Medicaid that will deny moms health care coverage?
I'm very focused on maternal health care. It's one of the metrics that our nation, I think, should be judging itself on. We do have to make investments, I believe, in maternal care in order to provide better sources.
So will you make sure that there are no cuts in the Republican budget plan that would deny coverage to pregnant moms and moms postpartum?
Senator Hazard, I have to be more knowledgeable about what's happening within CMS. I don't have any idea where the money is currently.
Let me be really clear. The Medicaid cuts are draconian in the Republican plan. The CBO has said that it will lead to significant cuts, and the cuts will likely lead to 10 states losing their Medicaid expansion coverage. So let's move on to another issue. Last week, the Trump administration put out a list of federal offices to close, including the only office in the North Country of New Hampshire where seniors can enroll in Social Security benefits and Medicare in person. If confirmed, will you work to ensure that seniors can continue to enroll in Social Security and Medicare benefits in person in Littleton, New Hampshire?
I don't know about why there was a decision to remove this center in northern New Hampshire, but I do believe seniors will be better treated if they can see someone in person.
Right. So do you think they'll be better or worse off in rural areas of my state if they have to drive 100 miles to the next closest office in New Hampshire to receive assistance with Medicare enrollment?
Well, one of the changes that I believe we have to make within Medicare in general is to modernize the way we communicate with our beneficiaries. It's not just about in-person visits. There should be a continuous, frequent, weekly even discussion that goes on, that we send out, that if beneficiaries want to process, they can.
Right.
If we can't communicate with our seniors and their families digitally, we're giving up a huge opportunity.
Well, guess what? Some of the plans that I'm hearing from the other side of the aisle are going to cut the efforts to bring broadband and internet to this exact area of my state. It's not just that some seniors don't want to use digital access. In a lot of rural America, they can't. So we need to have offices that are open, staffed, and accessible. Now let's move on to another issue. In 2012, you enthusiastically recommended several supplements for weight loss on your television show, including a substance called green coffee extract, which we now know was fraudulently marketed. For the record today, can you confirm that you no longer believe that green coffee extract is a miracle weight loss drug?
I never said that that medication was a miracle weight loss drug, but I am
can you confirm that this was fraudulently marketed and green coffee extract is not a miracle weight loss drug? Yes or no?
Yes.
Okay, so let's go on to, you promoted a supplement called raspberry ketones, claiming that it is, quote, a #1 miracle in a bottle to burn your fat. That's your quote. Will you confirm for the record today that you no longer believe raspberry ketones to be a, quote, miracle in a bottle?
There are many things I said on the show. I take great pride in the research we did at the time to identify which of these worked and which ones didn't. Many of them are still being researched, like the green coffee bean extract you just mentioned.
So how much were you paid to promote these supplements?
The television show was distributed by Sony Corporation.
How much were you paid to promote the supplements?
I was paid nothing to promote the supplements.
But you promoted them on your show, and there was something called a Dr. Oz effect. You would mention them and the sales would go way up.
That was written about by the press. That was not something that I would talk about on the show.
I will just go on the record that you have been nominated to run the largest health programs, the set of largest health programs in the United States of America. And it seems to me you are still unwilling to take accountability for your promotion of unproven snake oil remedies to millions of your viewers. And that's really concerning. Thank you, Mr. Chair.
Senator Whitehouse.
Dr. Oz, over here. As we spoke about when you visited, I want to talk about some Rhode Island issues, because Rhode Island has a very fundamental issue, which is that between 2018 and 2023, which is the most recent years for which we have data, Rhode Island hospitals were paid less than nearby Massachusetts and Connecticut hospitals by a margin of over 20%. The margin of underpayment for Rhode Island hospitals compared to hospitals across the border ranged from between 20% and 28%. As a doctor, I think you pretty well understand that if you've got two hospital facilities that are less than an hour apart from each other and that are in the same regional healthcare market, and one is paid 26% less than the other, you have created a massive and harmful distortion. Rhode Island has been on the losing end of that distortion for years, and I am sick of it. So I'm flagging that for you right now. One of the potential ways out is the AHEAD program, because a fee-for-service billing is going to screw Rhode Island, and we can't fix that. The way to do that is to get out of fee-for-service and to a value-based program. We just heard that the AHEAD program is going to continue forward. I'm delighted about that. You and I are going to be in touch about making sure that Rhode Island's AHEAD program competes fairly with Connecticut's AHEAD program, because they work off a cost basis. And our cost basis has been suppressed by 20 to 28% lower payments. You can't pay your nurses, you can't pay your cleaning crews, you can't pay your phlebotomists the same amount when your revenues are 26, 28% below your competition. And let me just add to this by pointing out, you know this area, right? You practiced in Boston.
I went to school in Boston, but I practiced in New York.
Okay. So from going to school in Boston, you probably know that Rhode Island's hospital complex in Providence includes Rhode Island Hospital, which is the only level 1 trauma center in southeastern New England, the only level 1 pediatric trauma center in southeastern New England, the only verified burn center in Rhode Island, an academic medical center, a teaching hospital, has a pulmonary hypertension center, and obstetrics and a NICU are at women and infants. It is a node of connected buildings that provides extremely high-level care. If a president is in Martha's Vineyard and gets hurt, Rhode Island Hospital Trauma Center is where they're taken. They fly right over St. Anne's Hospital in Fall River to get to our hospital in Rhode Island because we made the investment in level 1 trauma care. St. Anne's Hospital that they flew over would be paid 20+% more for the same services while delivering none of those options. So I'm going to be on you like a ferret to get this fixed. It is totally unfair. Bacchus Hospital is probably a 25-minute drive into Connecticut from Westerly Hospital in Rhode Island. It's probably a 25-minute ride from our trio of world-class hospitals, Rhode Island, Hasbro Pediatric and Women and Infants, to St. Anne's Hospital, just out 195. And for the same service, we get paid 20 to 28% less than in those hospitals. I am so sick of CMS right now, it just makes me infuriated. For years, CMS has sat idly by, looked at that payment differential and said, oh, what a pity, too bad, we're not going to do anything about it. And we tried to fix it through the AHEAD program. Oh, well, maybe, but I don't think so. So we really need to get this fixed. It is wrong, and it is really dislocating healthcare in Rhode Island. We have doctors moving over the border to take advantage of better payments. We have a fight for staff when we have to compete with other hospitals within the same commuting range that get better payments. So I have 10 seconds left. I'll leave it at that. You heard a lot from me when you came to sit with me. You heard a lot from me today. I'm going nowhere on this. In the years I've been fighting it, not once has any person at CMS ever been able to provide any excuse or any justification for it. None. They don't even try to justify it. They just don't give a red hot damn about this incredible unfairness that is dislocating and warping our healthcare system.